Today's video, I want to talk about the pandemic and homelessness. Let's do it.
I can feel the stars fall down where we are, where we are. Living in the glow, ain't it all beautiful? It goes on and on.
What has been the effects of the pandemic on the homeless population? The pandemic has produced a unique set of public health challenges, but the pandemic has exacerbated national crisis that existed long before the coronavirus. Nowhere is it more evident than in the pandemic's influence on homelessness and affordable housing in the United States. So COVID-19 has posed and continues to pose unique risks for people experiencing homelessness. Social services have become more limited throughout 2020, but the economic consequences of the pandemic have put more Americans at risk of entering homelessness. So the realities of facing homelessness and the pandemic are different, of course, for every person and family. Still, the national statistics around these dual crises provide important insight into the issue. So, I was interested in what the data would reveal. And from the data, I think these factors are some of the most important. So, if you take a look at this chart and the top 10 cities with the most eviction filings, looking at eviction filings, local rent forgiveness policies, the healthcare access for people experiencing homelessness. So the top cities where this occurred included number 1 is Phoenix, number 2, Houston, and number 3, Memphis. So spanning across the country and across different regional industrial centers, the large volume of evictions left many people experiencing homelessness unhoused as shelters were forced to reduce capacity. Increasingly, this surging number of evictions led to a federal order to temporarily halt residential evictions to prevent the spread of COVID-19. However, many landlords, this order created a financial burden of housing renters with no payments. So you try to solve one problem, then you have another. So the U.S. Department of Housing and Urban Development noted that in their 2019 annual report that in America's 50 most populated cities, African Americans make up the majority of the homeless population. Of the top 10 cities with the most eviction filings, number 1 through 8 all qualified for that top 50 designation, meaning that the added stress these evictions are placing on resources dedicated to assisting those experiencing homelessness may be producing outsized negative impact on the homeless population that are primarily composed of minorities. Also, there's a major issue with mental illness and drug use that needs to be considered. So looking into what caused these evictions, many would expect the largest indicator of evictions to be job loss. Therefore, we looked at states with the highest unemployment rates. So during the COVID-19. So look at this chart, 10 states with the highest unemployment rate due to COVID-19. Again, there was no clear region in the country where COVID-19 led to the greatest leap in unemployment. However, it is clear from the data that statewide unemployment has been closely tied to local industries and their pandemic-related losses. So, for instance, the top 2 states for unemployment as of October 2020, who would have thought, of course, were Hawaii and Nevada, both of which depend on tourism to fuel their local economies. For these states, people face unique challenges in moving out of homelessness as a lack of income severely limited their housing options, as cited by the National Coalition for the Homeless. So the states with the highest homeless rate pre-COVID-19 now, looking at pre-COVID-19. So having looked at these causative factors, I moved on to the data surrounding the prevalence of homelessness itself. I wanted to look at pre-COVID-19 data to get an indication as to where homeless was especially challenging for states, with pre-existing affordable housing, the crisis, which would give kind of a better indication. So according to data from the United States Council on Homelessness in 2019, the states with the highest rates of homelessness were Washington, D.C., New York, and Hawaii. While some of the percentages may seem low, it is worth noting that for states with larger populations like New York, even less than 1% of people experiencing homelessness translates to, tens of thousands of people who might turn to social services for support and temporary housing. So if we look at 10 cities with the most homeless shelters, so, look at this chart. Many states are unable to provide extensive support to these massive groups, which leads to greater rates of chronic homelessness across the states. A crisis that even preceded COVID-19. 100%, the states with the most existing homeless shelters also had the most robust system in place to provide temporary shelters to those experiencing homelessness. So top areas in the United States included, who would have thought, Washington, D.C., Los Angeles, and Baltimore. Unfortunately, as the public health guidelines have restricted person-to-person contact, many homeless shelters across the country have been forced to close, as reported by the National Low-Income Housing Coalition. So the states with the highest severe housing cost burden, or the percentage of households that spend 50% or more of their household income on housing payments, include, who would have thought, California, number one, New York, Hawaii. While all these statistics offering insight onto which states may be especially vulnerable to experience homelessness as a result of the COVID-19. So we also wanted to look at the health effects on the severity of housing costs, and of course, skyrocketed across the board. So when you look at beyond all these concerns, there is still the reality of the virus itself and the impact it has had and will continue to have on the health of individuals experiencing homelessness in this country. So given the advanced ages and underlying health issues many of these people experiencing homelessness have to deal with in the best of times, the increased infection rates and lack of healthcare resources because they've been shut down represent a significant threat to America's homeless population. And we seem to have forgot about them, and they're the most vulnerable to disease. So with this data reflecting that homeless during COVID-19 is widespread and far-reaching in its impacts, it's so important that the public health of the population is carefully considered. We just seem to forget about this population as we move beyond the pandemic, and lingering effects of homelessness shape the lives of so many people. So, awareness of, how public households, budgets, and social services interact will be essential for the future. So, this is a vulnerable population that is high risk with multiple risk factors, and we just seem to put them to the wayside. And the same thing is, we're the only country it just doesn't make sense to me. We're the only country in the world that didn't shut down our border during a crisis, and over 12% of the people coming across the border, my understanding from the research, have coronavirus, and migrants who are not U.S. citizens aren't required to get the rigorous testing that U.S. citizens are required. So we forget about the homeless population. We put migrants into this country, and I'm all for legal immigration. And these people are vulnerable and sick, the homeless, but we're not following up with them to make sure they're tested. And then we have people coming into this country, the only open border in the world, but we're in the middle of a pandemic. So if the pandemic is so dangerous, why are we having an open border? That's a fair question. So we have an open border, it's interesting. So, statistics from the CDC, and they're out there, 99.9% of people under 70 do not go to a hospital and do not die from COVID-19. 99.7%, that includes people over 70, do not die and do not go to a hospital. So those are interesting statistics. I don't know what they mean. I think everyone focuses on the cases. I look at all the data, but we should focus on the mortality rate, because 300,000 to 600,000 people die worldwide of the flu, and they're dying every day. We don't talk about the flu cases. We talk about the mortality rates. Mortality rate is the most important when assessing a disease. And if our hospitals are going to be overburdened, and thank God right now our hospitals are not overburdened. Thank God in the beginning of the pandemic we had good preparation, and we didn't use the ships that we thought were needed because we were ahead of the 8 ball, and all the ventilators that we didn't use. So I'm off my soapbox, but we're forgetting about certain populations like homeless. And this is something that's near and dear to my heart, and I have investor backing now, and I'm getting more. And this is something that I'm going to put a lot of money into. I'm not just going to talk about it like a lot of people. I know what's going on, and people have these big salaries, and they're not doing anything to fix the problem. I get what they're doing. They don't want to fix it, and they want to get their money. But I got backing by some very important people, and I'm going to work on this issue. And, this coronavirus has had me reassess my life and realize I've been a little selfish and so focused on me and myself, and it's all about money and this and that. And that's not what life's all about. It is about giving back, and when you get in a position to help people, I still have a lot of things I want to do in life. I'm just getting started. But this is one of them. And I think it's terrible, and I think it's disgusting what's going on throughout this country. And the big issue is we got a lot of other moving parts with drugs and fentanyl coming in from China and mental illness that seems to be put to the wayside, and that's a big part of the homeless issue, not just jobs. We have a very vulnerable population that has mental disease and drug use. But, I don't think our leaders are doing what they should be doing, and there needs to be some checks and balances, because it is getting out of control. And it's shameful to this is the best country in the world. Still is. No matter what anyone says, it is. If you've traveled all over the world, go to Somalia, go to Iran, go to China. 1 million Muslims in internment camps. People throwing gays off roofs in Iran. I've been all over the world. I've been to the Middle East. I've been everywhere, almost, except North Korea. So it's terrible what's going on out there right now. So this is an issue that's near and dear to my heart, and I'm going to put some money behind it. Get ready. Take care.